Okay, so just to recap from that, you did the primary survey and you were shown the recovery position. You will be practicing that on the practical component when your physical session comes up. So just to recap that, we used this acronym or guide to help us, and it's essentially Doctor, we call it ABC or DRAB. You should make sure that the scene is safe to give care. I cannot emphasise that enough. So many people become injured on motorways or in large accidents whereby they're not paying attention to what's around them and they try to give care. And, think about people who jump into rivers to save their animals, and unfortunately both the owner and the animal perish. So you need to think about your own safety as a priority. You can give care to no one if you're incapacitated. Response is to make sure that the casualty can speak to you, and if they can communicate to you in a meaningful way, that's great. They're breathing and they can tell you what's happened. If that's not the case, you should be looking for a clear and open airway, because the tongue can cause a major obstruction when you've got lower levels of consciousness. It can basically slip down the back of the throat and partly or fully close the airway. There it is there. And by opening the airway, head tilt, chin lift, you've opened, and they can start breathing. That may be all you need to do to save someone's life who's got a lowered level of consciousness, and I've actually witnessed that happening. And I've got a friend who's and works in A&E for many years, and it still amazes him how many people start breathing normally once they've opened that airway. Yeah, so just check for breathing. We're not actually going to go into too much depth on choking. Feel free to look through the book to give you some background information, but your trainer on the day will conduct practical sessions on identifying and action on choking. Yeah, the treatment is typically back blows, and in adults the abdominal thrusts. But it just depends on the situation. When we start to look at other activities in children and infants, these treatments are modified because of their size. But again, your trainer on the day will go into depth. This is very much a practical session, but it's something that's really important because choking is a very common occurrence. Yeah, I think there's something like 8,000 choking admissions every year into A&E. So again, you're going to be practicing the practical application of managing shock, but shock is the lack of oxygen to the tissues of the body, and it causes a fall in blood volume or blood pressure. So shock can be caused by severe bleeding. It can be caused by some kind of allergic reaction. But if there's insufficient shock and the volume drops, and fluids start to get lost, then that's when the patient can start to become unwell. If there's major blood loss, you need to get that patient laying down and to raise their legs. The things you're looking for are they look weak, dizzy, and they can sometimes faint. Their pulse is normally rapid, but it's weak, and that's because the heart is having to work faster to try and get the blood round to keep the body's pressure up. Imagine it a little bit like a central heating system, and there's a breach in the central heating system, the pressure's going to drop. It's exactly the same. So the skin's typically pale, and they're very clammy to the touch and cold. I mentioned about the pulse, and the breathing would typically be shallow and rapid. Again, that's the body trying to compensate for not having enough fluid in the body to help the system work at the right pressure. dizzy, lack of oxygen, thirsty, lack of fluid, and nausea as well. There's going to be confusion because there's lack of oxygen to the brain, and they're going to be stressed and anxious and aggressive. And the reason for that is they realise their body's in trouble and they've gone to a defensive position. You know, it's a little bit like that fight or flight, that their body's saying, look, you're in trouble here, you need to start making adjustments. So the thing to do is to treat the cause. Now what we're talking about is if they have had shock through, say, an allergic reaction, we can treat that. Or if they've had shock through lack of blood, that's the best thing to do. So treating the shock is a secondary thing. The primary thing is to treat what caused that shock in the first place. People will ask potentially for a drink because they're very thirsty. We're trying to avoid that. Should they require further medical treatment, anaesthetic, things like that, fluid in the body, in the stomach primarily, can cause big problems to their breathing and their airway. So we try to avoid giving them anything to drink. You can moisten their lips and give them the tiniest sip just to moisten their mouth, but no big gulps of water, because that could cause problems when they get to A&E. You need to loosen tight clothing, so anything like ties, belts, anything like that, that should be loosened. Unbutton the collar to make sure the blood flow to the head is as good as it can be. And monitor breathing, pulse, and how responsive they are. So you're constantly talking to them, ask them, how's it going, how you feeling alright, you feeling warm enough? And that conversation will tell you what the response rates are like. You know, having the legs up obviously will push the blood through gravity towards the head, and that's the important thing. If they've got blood volume within the head area, they can be responsive, and it manages everything else. If the blood goes to the legs, e.g. the stand up, then you're looking at them fainting, and that's not what you want to happen. So a faint is a brief loss of consciousness due to a temporary reduction in blood supply to the brain. If you've suddenly stood up before, or if you've taken a funny turn, you've experienced this, and by simply sitting or laying down, you can regain composure quite quickly in most circumstances. So there we have, we've got the normal blood supply, and typically what happens is the blood vessels actually dilate. They can lose their elasticity for some reason, or they can suddenly open up through shock, or through any form of high levels of anxiety, and that can cause the blood pressure to drop. There's insufficient pressure to actually keep the blood moving around correctly. So it's the same treatment as you would do for shock. Lay the patient down, raise their legs, make sure they're comfortable, make sure you've got airway and breathing, which is always the priority. Always talk to them and remove from the source of stress. Again, it could be an incident, they may have overexerted themselves, they maybe witnessed something that's upset them. You would try and block them from all these other factors, which is going to cause them additional anxiety. Same treatment for shock, loosen tight clothing. They're going to want to get up. It's slightly embarrassing, so you're going to try and be diplomatic with them and say, look, just have a seat for a minute. If they're going to get up, don't sit them in a chair, keep them on the ground for a little while, because if they do become faint again, it's easier to bring them back down again. If they don't improve, which should be quite rapidly, then you should consider activating the emergency services. Now, anaphylaxis or allergic reaction is a form of shock, but because of the increase in allergies predominantly in children, it's become one of the most talked about subjects in early year settings. And typically what you'll find is if it's a serious anaphylaxis, there'll be an overreaction, a massive overreaction of the body's immune system. Our system is designed to attack any form of risk to the body. However, It can get confused, or it can become overreactive to certain trace substances. It could be ingested food, or it could be a bee sting or something like that. There's a multitude of things that can cause this. Some forms of medication can cause an anaphylaxis. So the thing to remember is the treatment remains the same, although you've got many different reasons. So here's what happens. Anaphylactic shock. Again, like fainting or any shock, you've got the blood vessels dilate and the blood pressure drops. The heart is weakened and the pulse is very rapid but weak because, again, the heart's trying to work harder to get the blood around the system. Foodstuffs. There could be many things that can cause that reaction. Strawberries could be another one as well, peanuts. You can have any sort of allergy to any substance that can set you off. Typically, early exposure to something doesn't give a full reaction. It tends to give warning reactions, and that could be something to keep an eye out for if a child does respond quite poorly to something they've had for the first time. Typically, the second or third exposure could cause a full-blown anaphylaxis, so please bear that in mind. But there's the classic picture that's used pretty much in all the first aid books. The child's got a rash, very puffy face, and obviously they've ingested something or touched something to their mouth which has caused that. Yeah, a lot of puffiness. Fluid basically builds up around the head and neck area if anything's been ingested. You can have skin markings, and the pulse can become rapid but very weak. Breathing's the main issue. The airway closing is a significant problem when it comes to anaphylaxis. Anything like that, if you witness that, you should be activating the emergency services. That's nothing that's going to improve in a short period of time. You should be telling them what you're seeing, but if you think it is an anaphylaxis or it's an allergic reaction, you need to tell them that they're having a big allergic reaction, and that will ensure that they're dispatched at the top priority, because it's a breathing problem and they need to get that fixed very quickly. It is possible to assist a person who has a known allergy and who carries medication, and it's in the form normally of adrenaline through an auto-injector. However, you should be given authorization within the setting to give it to the child if they're carrying it, and you should also have some training. Again, if you talk to the trainer on the day, you should have some auto-injectors and to go through some basic training with you to ensure that you're comfortable with that. There's different products. It's not all the same manufacturer. EpiPen is the most common one that everyone talks about, but actually there's lots of other ones. We shouldn't be giving other people auto-injectors from other persons because they're all specifically prescribed for other people. I am aware of some settings that may be authorised to have a generic auto-injector, but that could be only for specific circumstances. You need to check with your local authority for guidance on that. Treatment for anaphylaxis is very limited if you've not got any adrenaline. So while you're waiting for the ambulance, again, you should treat the patient with your primary survey, ensure they're breathing, treat them for shock, and also be aware that you may need to put them into the recovery position if their airway becomes a problem, and you may actually have to start trying to rescue breathe them if their breathing becomes laboured, or if they actually stop breathing fully. It's a very serious condition. You require the ambulance, really.